Lecture there starts talking about exercise as a modifiable risk factor in glaucoma conversion, glaucoma progression. And then I'm sitting in on a diabetic lecture, and they're talking about exercise as being a modifiable risk factor, which we all know, but sometimes we underappreciate as it relates to diabetic retinopathy. And then I'm sitting in a macular degeneration discussion, and they're talking about exercise. And for me, the light bulb went off. The three big eye disease, and I would throw dry eye in there, but exercise is a significant modifiable risk factor. So that was the moment for me where I said, I need to dig into this a little bit deeper.
Eyes and shine there, my friends. Dr. Allen here, and welcome to the I Give a Damn podcast, brought to you by Fluorescene Media, the same company behind ODs on Facebook. Today, we get to hear from Dr. Mike Cymbor. Dr. Cymbor is an award-winning doctor of optometry and fellow of the American Academy of Optometry. He's well known for his lectures in glaucoma as well as advanced specialty testing. And today, we get to shed some spotlight on his path through the profession of optometry, as well as some of his passions, including that of which exercise and how it affects the diseases that most commonly cause blindness in the eye. And so today we get to hear a little bit more on which type of exercises he's found in the research have the most impact on these diseases and helping our patients prevent vision loss. If you've never met Dr. Cymbor, hearing him, you can just tell how much passion he has for the profession, for his work, for his patients, and it's truly just, this was an enlightening conversation. So please join us by liking, subscribing, following here on the channel, and here we go with Dr. Mike Cymbor. Again, Mike, thank you so much for spending time out of your day here at Academy. We're all very busy. We have a lot of things to do. So thank you for taking some time out of your day to jump on the podcast and share a little bit of your story, your passions, and why you give a damn.
You're welcome. I appreciate the opportunity, so thank you.
As with most of our guests, I really enjoy getting to know the background of how people found the industry of optometry to begin with. I think it's a very unique specialty. Like, how many people really enjoy looking at eyeballs? There's some people who are totally grossed out by it.
Yeah.
So, and then being able to have the skill set of managing so much math, so much biology, just the physics, and then just the being able to talk with humans. And then there's the business side of things. So you're juggling a lot. So how did you find optometry? How did you even begin?
Yeah, for me, I would say there were two aha moments. First, I started wearing glasses when I was maybe 6 or 7 years old. That wasn't an aha moment, but I did. I was into eye care at an early age and realized the importance of it. But the two aha moments. The first was when I got my first pair of contact lenses. I was in 9th grade, and so I got those contact lenses, and I remember it was during basketball season, and I remember wearing contact lenses for the first time. And prior to that, my parents made me wear, to their credit, these sport glasses, and they were these big black, just goggle kind of things. And I remember, playing, and not only could I use my peripheral vision in basketball for the first time, possibly ever, but I remember there were some girls in the audience, and I remember I heard them say, "Hey, who's that new guy?" And I was like, I've been going to this school for forever, and they think I'm a new guy because I'm not wearing the. So I knew the power of contact lenses and what that could do to someone's self-esteem. The second aha moment was during my senior year of high school. We had this thing called Senior Career Month, and we could spend some time with whatever business we wanted to the last month of school. And I went to my local optometrist and said, "Hey, can I come in and observe you for the last month?" And he said, "Absolutely." And I remember he had these Polaroid retinal photos. You click and the Polaroid comes out, and he's pointing them out, and he said, "You see all these hemorrhages? This patient has uncontrolled hypertension." And I looked at them and I was like, "You can see that in the eye?" And that was the moment where I was like, "This is what I want to do for the rest of my life."
That's an amazing and beautiful story for a couple of different directions.
Yeah.
And it's actually kind of similar to my own in that's how I really fell and even kind of was aware of how cool optometry was.
Yes.
Was because of contact lenses for that
Yes.
same thing. I wanted to be in sports, and it opened up so many other doors for me.
Yes.
So how did you go from going to school in optometry and end up where you're practicing today?
Yeah, so my, I practice in State College, Pennsylvania. Penn State is in our backyard, and my wife is a Penn State grad. And so we had the chance to come back to the area. I grew up in Pittsburgh. I went to school in Philadelphia. I actually went to undergrad in Erie, and then I did my residency in Wilkes-Barre. So I hit all different parts of Pennsylvania. I hadn't really, spent much time in the center part of the state. And so when we had the chance to move to State College as my first job, we kind of jumped on it. And it's been just a great place to practice, a great place to raise kids, and just a great place to live.
Well, you're selling it pretty hard. That's great. Now, we're going to talk a little bit more about your academic success and your kind of clinical success, things that you've built and worked on, some of your passions. But first, I do have to start off by kind of asking you some questions about some more recent highlights you've had in the world of social media the last, year and a half?
Yes.
So
Yes.
For our viewers, listeners who have not seen the Night of the Living Dem or DEModex video, then definitely check it out on YouTube. Otherwise, we'll link it up in the show notes for everybody. But
thank you.
For people who haven't seen it, it's amazing and it's creative and it's well put together. It's well produced and it's funny.
Yes.
So being able to accomplish all of that is a challenge.
Yes.
But how did you guys even get motivated? How did you guys even come up with that and start that project?
Yeah. Well, I'm going to try to keep this short, but it really stems from when I was in grade school. I was really involved in school plays and things like that, and I really have kind of an interest in that. And then when high school comes, and I was also an athlete, so I'd play baseball, football, and basketball. And at least when I went to high school, those two things, the arts and sports, really don't go together. And so I really had to put that creative side on the back burner. And then I was, really kind of in a science track, chemistry major, and then, optometry school. You don't really have an opportunity to explore that side. I was in a band in college, so that gave me a little bit, of that kind of background. But and then practice starts, and you're so busy with that, and you're raising a young family, and so really didn't have an opportunity to explore the creative side. But a few years ago, I was able to with Frank Tim is in the video. He is one of our opticians who is also this video producer wannabe, essentially, in the same way that I'm a theatrical wannabe. A dreamer. That's a good way to put it. And it's like, okay, he and I would have these conversations, and we started producing these really short videos, and they were mostly promotional from a lecture standpoint. Hey, this is Dr. Mike Cymbor. I'm going to be talking about angle closure glaucoma at the academy. Come, here are the dates and times of those things. And those would get a little bit of traction. And then we started incorporating a little bit of humor. And then Frank and I would kind of riff ideas off of each other. And so it was like this creative, exploring the creative side is so rewarding, as I kind of, I'm way through my midway of my career, right? And so I now do things that give me joy, and creating these videos with humor involved,
right.
they really give me so much joy. And having a creative partner like Frank who experiences that same amount, and with other individuals within the practice who also want to explore their creative sides. We started, maybe with 1 minute videos, and then they, 2-3 minute videos. And the video we just released yesterday was a 4 minute video. So I really do enjoy, that part part of my brain, I think.
Right.
Yeah.
And it shows a little bit of sense of your humor, or whoever, the little mix probably of,
yes.
of everyone's sense of humor, because it's always so different.
Yeah, exactly. And you know, it's hard to say what is going to resonate with people, but we just kind of do it because we think it's funny, and we hope that others, you know, get some.
And I imagine it's also somewhat of a bonding experience even for your clinic members who are in it.
It really is, because even the ones who are in it, even the ones who aren't, they're like, "What is going on? You know, what are you guys doing?" And and I think it just kind of sets the tone where, you know, eye care can be serious and it's important stuff. We're preventing blindness, but at the same time, I think, you know, our culture is, we need to do great, give a great patient experience, but we also want to have fun in the process. So it allows us to kind of show our fun side.
Have other patients seen these other kind of humorous ones?
I would say it's mostly optometric related, but on occasion, in fact, I'll post this. I started a Facebook page recently. In fact, my wife started a Facebook page for me. I do well on LinkedIn. I don't do well beyond that, so my wife is kind of helping me out in those things. So I will post this on my LinkedIn page, and we did do the night of the Living Dem. We did do some Facebook stuff, and so patients do have access to that. And it's always like, "Whoa, Dr. Cymbor, I knew you were a decent eye doctor. I didn't know you could do that kind of stuff." So that's kind of fun.
It's great to have some other hobby, some other interest,
Yeah.
especially just to spark imagination and drive you forward. Right?
Yeah, you said it well.
Now beyond these videos and cool stuff, again, on a more serious track, you've had great success in a lot of areas and many kind of subspecialties in eye care, I would say. But you're pretty famous for CE, and you've done research, and your kind of big passion is in the world of glaucoma. Would you say it's your first love, first big passion?
Yeah, I think that was. I think that, I think as optometrists we have the luxury of being generalists if we want to, but as time went by, I really started getting more involved on the glaucoma topic. And for me, one of the coolest things was the first time I went to an Optometric Glaucoma Society meeting. It's the yearly meeting. It's given a day before the Academy every year. And the first one I sat in on, it was like 9 hours straight of glaucoma. And towards, the end of the day, some of my colleagues are like, "Oh gosh, what a long day." And I was like, "Are you kidding me? Like, this is so much fun." And then I realized, okay, this is what I need to explore. And so glaucoma was a priority for me, but I would never say I was kind of a glaucoma specialist. We brought in an ophthalmologist maybe 6 years ago to our practice, and he is fellowship trained in both cornea and glaucoma. And he kind of saw what I was doing on the glaucoma side, and he kind of said, "I really enjoy, what you're doing, and we have these great conversations about mutual patients." He said, "I think we could probably enhance both of our services if we teamed up and created a Glaucoma Institute." Like, that is a moment that not everyone gets a chance to experience, but it was a moment that I did, and that really changed, in many ways, the way that I practice. And having, that kind of relationship, that synergistic relationship, for all of the, the battles that we have between professions, this was a moment of purity, and our patients, all of our patients in the State College area have benefited from that. So I guess I would say that when optometry and ophthalmology can figure it out and get past the turf wars, great things can happen, and the people that benefit are our patients. And so,
very well said.
Thank you. And so that's been great, and kind of getting his perspective on kind of surgical management, while giving him my perspective on medical management, and kind of marrying those two together and taking the best of both worlds has been really a rewarding thing for me. and so that, as well as seeing kind of more esoteric forms of glaucoma, uveitic glaucoma, neovascular glaucoma, things that I wasn't seeing on a regular basis, I'm now seeing on a regular basis. And it's given me, kind of a more complete perspective on the field of glaucoma and has allowed me to really dig in at a deep level.
Mm-hmm. Is there anything particularly like beautiful or something about glaucoma that just really attracts you, that it kind of one of the reasons you really sunk your teeth into it?
Yeah, I think you have two types of clinicians that are that find glaucoma attractive. You have the pure scientists who may not have the best bedside skills, right? And then you have this other group that really enjoy communicating with patients. And I would put I would put myself in that key. That part, that bucket, essentially. And so what we're dealing with is this typically slow, not always slow, but typically slow, nefarious disease that patients have almost no symptoms until. And so it takes, in order for patients to really understand and buy in, it takes a certain level of communication. And so that's really what has drew me in. I love the patient-doctor communication and having those moments together where you can see the light bulb go off, and for them, and kind of saying, okay, this is the reason we're doing this, and I'm going to do my best to preserve your vision. And we've got you've got a long life ahead of you, but if we work together, we can make this happen. So that is what attracted me, as well as I'm a little bit of a gadget man. I really do enjoy like digging into the OCTs and what's the normative database, and there's so many little pieces of information, and it can be challenging sometimes to say, okay, which is the most important in this particular patient's case. So I really do enjoy that. So it gives this this great communication, but yet getting involved in all these minutia. Those two things together really shine for me.
And definitely in the world of glaucoma is probably the one specialty within eye care that probably has the most of those type of tests and gadgets, whether you're measuring something like an ERG to an OCT, and now we have OCTA if you're going to be able to kind of maybe look at that for some level, whether you're looking at ganglion cell analysis to just the classic field, are you using stereo photos, are you doing central corneal thickness, are you looking at, there's a lot of little things. But then, was it done correctly? Is it reliable to begin with? Like there is a lot of that.
Yeah, no, I completely agree. And so for me, it's like I love bringing in all this new technology, and it surprises me how often, if we take our whole the number of tests that we take, and any one can be really significant, for any patient. And so sometimes it's OCT that really, gives me a good understanding of what's happening. But sometimes it's field, sometimes it's hysteresis, sometimes it's pachymetry, sometimes it is ERG, sometimes it is OCTA, and you never know. And so it's nice having all of them together to be able to, as the doctor, really pick out in each patient's case what really is the most important.
Right. I know for myself, I love that educational component too. I always try to say, how can I break this down in a better way? Like on my drive or commute into work, my brain is still trying to come up with some new analogy or a new way to explain it.
Yeah, that's good.
For glaucoma, my favorite one is I just try to tell people it's the simplest way I can say it is where there's cell death.
Yes.
It's just where the nerve is slowly dying.
Yes.
Unfortunately, if your nerve's going to die in your foot, you'll feel something change.
Yeah.
But the retina and the eye doesn't, in a good way, it doesn't have pain receptors. But the bad side of it is that we can't feel that something's wrong.
Yes.
And so our only way to measure it is with eyesight. And you it won't happen. It won't be affected till it's too late.
And I think it takes a really, a good communicator to get that message across in a way that they buy in. The other thing that's, that you're touching upon that's so fascinating in the field of glaucoma, there's so much that we don't know. Meaning, I was taught in optometry school that, glaucoma is a one-way street. And you have cell death, and that's it, and you can never regain that. And I think we're finding the newer research is really saying that you can have retinal ganglion cell sickness. So ganglion cells can be alive, they can be dead. We know that, but there's this intermediary state where they're sick, and if you can lower pressure at just the right time point, you can rehabilitate it. At the Optometric Glaucoma Society meeting yesterday, 2 days ago, there was some discussion about using insulin eye drops to actually allow retinal ganglion cells to recover, like groundbreaking, unbelievable. So here we were taught all these things, but within glaucoma, because there's so much we don't know, there's so much that we're learning with newer research, and I find that invigorating.
It is, and just to think how it's basically giving metabolic support to the cell.
Yes.
And so there's a lot we can talk about that too, because I know we're going to ask about we're going to talk here in a moment about some more of the more recent research and fascinations you've been finding in exercise and its relation to ocular disease, and certainly blood flow is an important component to the optic nerve.
So true.
So first, beyond just glaucoma and your kind of fascination with devices, that kind of spreads into also, you also don't just do glaucoma, you also have some interest in treatment for dry eye and ocular surface disease.
Yeah, thank you for bringing that up. And dry eye, I think every optometrist to some extent has so much experience with dry eye, and it's been a frustrating journey in many ways, because it's this, we now realize the importance, and we now realize the effect it can have on someone's life. And so for so many years, it was really underappreciated. And so you would have these patients come in, and they would explain about how it is affecting their life, and we would just roll our eyes and say, come on, how bad could it really be? But now there's a lot of good research looking at quality of life to say it really does impact quality of life. And so I had a lot of those, frustrations, because we never had too many good options. And then we would have drug X, and this was promised to be, the cure for it. And we realized, okay, drug X doesn't really live up to the hype. Then we have drug Y and drug Z and so forth and so on. But when you start to pair some of these things together, you can give patients relief. And so I had that experience. Then when you combine that with the Hippocratic oath of do no harm, and being a glaucoma specialist, knowing that every time you prescribe a medication that has benzalkonium chloride in it that's being used over the long haul, you are interfering with homeostasis of the tear film, and so you're contributing to ocular surface disease. And so kind of having that realization, and it comes from a really good place. Hey, I'm trying to preserve vision by prescribing these drops, but I'm also maybe underappreciating the fact that I'm creating ocular surface disease. So when I had the intersection of those two ideas, it made me realize, as a glaucoma specialist, I need to be doing better. And so that's really kind of gotten me involved in dry eye.
Do you talk to your patients when you're prescribing, let's say, a generic prostaglandin analog?
Yes.
Do you have that discussion with them? Do you say, I would recommend this new preservative-free one?
Yes.
Or do you say, okay, financially, if you can't do that, this is what we need to be concerned about long-term?
Yeah, absolutely.
Not just fat deposition and iris color change. But going as far as there's a good chance over time you're going to have worse dry eye.
Yeah, I have that discussion on a regular basis. And the number one prostaglandin that I prescribe is not a preservative filled drop. It's a preservative-free. It really is Zioptin, and I have no conflict of interest with Zioptin, but that has really historically been my favorite if I'm going to prescribe a drop. I'm also a big believer in interventional glaucoma, so I'm recommending SLT at a very early time point, and oftentimes as first-line therapy, I'm recommending it. And so I will have that discussion with patients, because how often do we kind of default to, hey, what's going to be easiest on your formulary, because we don't want callbacks and we don't want our staff, the pharmacy's on the phone again, Dr. Cymbor, what do you want to do here? And so sometimes we take the path of least resistance, but that path often leads to ocular surface disease. And so, I do recommend preservative-free. Often I am having that discussion by saying, hey, we could go with drug X because it is on your formulary, but drug Y, I think, is going to be superior to you for a long-term treatment basis. And I need to preserve not only your vision, but your ocular surface for many years to come. And that's why I'm choosing drug Y. And on the front end, it might be a little bit more work, but in the long term, it's going to be a better choice for you. So I am having those discussions.
So you guys don't just have the Glaucoma Institute, but do you also have like a special dry eye suite or dry eye institute? How does that work?
We do. And if I think back to 6 years ago when we started the Glaucoma Institute, that really invigorated me in a big way. Not that I was feeling stale or tired or any of those things, but it really invigorated me. And so when we finally had that decision, and this is something we wanted to do for years, but never made it happen. But about a year ago, we're like, we finally need to start the Dry Eye Institute. And so we got that off the ground, and all the challenges and how many barriers, to overcome. But those are just challenges, and they can be overcome, and they were overcome. And then I realized, once I started digging in a little bit deeper, like, wow, this is fun. This is, getting to that, that upper level management of just not prescribing artificial tears and hoping that things go well. That's been a real, and so I think in many ways we have to reinvent ourselves. And so how many people say that, when things start getting stale, you need to reinvent yourself. And so that's been one of those things that has been strangely, for me, invigorating.
And I think I had a similar experience when I was in my first few years of practicing, and was just seeing a lot of routine, but then I had patients struggling with dry eye, and I at least had a little bit more familiarity with beyond just prescribing medications, but I knew how to use amniotics, and I knew putting in punctal plugs, and I was getting results, and my patients were seeing I wasn't just seeing the benefits in the clinic, but they were experiencing that benefit, and then they were sending their friends and family, and now I have some of my favorite patients I see in the morning. I see my clinic list, and I see their name, and I'm just like, I am so happy to see them, because I for some of these people that are really struggling, you're seeing them every month for a few months while they're healing. And now it's like, I only have to see them once every 6 months, maybe, just because they're doing so well. And that just it just fills you up.
It's so rewarding, right? And as time goes by for me, I'm in my early 50s, like, what gives you purpose, right? That's a question that I find myself at, I ask myself more and more as I get older, what gives you purpose? And the Glaucoma Institute gives me purpose. And there's so many things about optometry that give me purpose, but now this Dry Eye Institute, being able to take care of these patients at it may be a different level than I have before, gives me such a sense of purpose. One thing I have to point out for your listeners is, like, your analysis of the PRN fish oil, that was brilliant. I thought that was so well done, and I really enjoyed it.
Thank you.
And so I do share that, with colleagues and patients. So if you haven't watched it, go back and go back and watch that, because that's a really a great piece.
I appreciate that. I tried to break that down into 3 different components. The first video I did was just like, I'm not going to talk about any brands. I just want to break down what I've read, what's been published up to date about omega-3s and dry eye, and even the debate. Because there's still some debate.
Right.
And then I did the next one, which was just breaking down, okay, what is what are the brands that are recommended?
Yes.
What can you find locally?
Yes.
What can you find online? What can you get at your doctor's office? And
Right.
and why some are recommended, again, based on that research.
Right.
And then the final one was my personal testing.
Yes.
Which I tried to take a little bit more of a true scientific approach to it, just to
Yes.
document where my symptoms are at, where the oil production is at, what my eyelids look like,
Yeah.
and then just being consistent.
Yes.
And doing a blood test before and afterward. And so that's and I plan to do kind of another version of that coming up soon. So we'll see how. It just takes time.
It takes time, but it's always that. There was that aha moment where you knew the science. You kind of thought about dry eye in a certain way, and then once you experienced it yourself, you were like, "Wow." Like I'm not sure I expected that, and so that's a fun moment that we have as clinicians and patients.
But thank you for mentioning that.
Sure.
I kind of want to switch gears back, just because we were before we started our episode here. We're talking a little bit about, again, what drives us, our purpose, and you had mentioned a big thing for you is mentorship.
Oh, mentorship, yeah. And so we've been mentoring optometry students. We're an externship site. And we were an externship site with PCO, Salis in Philadelphia for really as long as I've been in practice. And then we started more recently with SCO in Memphis. And being able to bring those students from different backgrounds together has been really rewarding. But again, one of those things, as time goes by, I realize you just kind of take it for granted in some ways. Hey, you get a chance to work with these students. But walking around the academy this week, and I meet previous students like Clark Chang at Wills, or Emily Seitz, who does this amazing social media stuff, or Raman Bakri, who is now the assistant editor of one of the academy journals. And it is just so fun and they'll come up and say, give me way too much credit for for their involvement, and so it's just so fun, and I think going back to that sense of purpose, that really gives me an incredible sense of purpose. So for your listeners out there who are kind of thinking about, maybe I should be an externship site, or maybe I should be a residency director, but maybe not, being able to impact these young optometrists has been such a rewarding thing for me, and it gives me and never do I experience that as much as at the academy.
Right.
Yeah.
I know a lot of doctors I've talked to seem to be really interested in that. They pass down this legacy of knowledge and experience beyond just clinical knowledge, even going into as far as just professional life, business. There's just so much that we can help each other with. Yeah. And I think that is a beauty in the profession of optometry. Because I think I don't know many people who get into this profession if they don't have some level of passion for what they do.
Yeah, that's right.
And so I think it does, especially as life goes on, you're just like, no, I want to. There's ways I can help improve the lives of others and expand and keep helping this profession.
Yeah. Oh, another name that comes to mind is Jimmy Diem. He does the Try Not to Blink podcast. He was a previous intern, and he says the same thing. And so you take these things where I'm doing these funny little videos that are out there, but you have these people like Jimmy, who are really impacting it in a really big way from a social media standpoint. And to think that maybe there was some small role that we played in that gives me great pleasure.
So back to one of our earlier, we kind of mentioned, and this is something I'm really fascinated to hear what you can share with us, is around exercise and maybe new research and discoveries on associating exercise with ocular health.
Yeah. So thank you for asking that. And so what I would say is, for me, the aha moment with that was I was sitting at last year's academy, and I'm sitting in on the Glaucoma Society. And the glaucoma, in the lecture there, starts talking about exercise as a modifiable risk factor in glaucoma conversion, glaucoma progression. I'm like, wow, I've never heard that. And then at the World Glaucoma Association this past year, 2 months ago, like a large part of their program was devoted to exercise and how that relates. And I shouldn't say I've never heard of that, but we'd always hear it in this general context of, healthy diet and get some exercise, but it wasn't at this level. And I was like, wow, okay, that's interesting. And then I'm sitting in on a diabetic lecture, and I think it was Paul Chouse and Jeff Gerson, and they're talking about exercise as being a modifiable risk factor, which we all know, but sometimes we underappreciate as it relates to diabetic retinopathy. And so I was like, okay, that's interesting. And then I'm sitting in a macular degeneration discussion, lecture, and they're talking about exercise. And for me, the light bulb went off, and it's like, wow, the three big eye disease, and I would throw dry eye in there, but as well. But those three eye diseases, exercise is a significant modifiable risk factor. So that was the moment for me where I said, I need to dig into this a little bit deeper. And so I've spent, the last year or so since that time really kind of asking, is there enough research out there to where we can draw some meaningful conclusions? Mm-hmm. And so by the time I submitted my academy, lecture there, I thought this was a ripe, subject area to delve into a little further.
Can you, I don't mean to put you on the spot, but can you
please
share just a little bit more information, maybe specifically in the realms of whether glaucoma, if that's something off the top of your head, or what kind of research findings have been kind of coming to
and in fact, probably what I'll do is I'll start with diabetic retinopathy, because I think that's the most kind of common sense, and that's really the whole thing with diabetes and diabetic retinopathy has forced me to kind of go back and relearn the physiology that we learned I learned years and years ago. And so we really start to think about what's one of the most important metrics as it relates to overall health, which is blood sugar levels. Meaning, let's say you wake up. What's your blood sugar level at that point when you first wake up? And should you exercise straight away, or should you eat something first? And then what happens to your blood sugar when you do all of those things? And so kind of digging into that has really made me think about blood sugar levels at a much deeper level. And what I learned and what I came to realize is that, how do we increase blood sugar levels in our bodies? Well, we have a couple of different ways of doing that. Of course, the one we all think of is we eat something, and that causes our blood sugar levels to rise. And then, but let's say I want to get up and exercise without eating something. How do my blood sugar levels rise at that point? Well, the second way that we can get blood sugar levels into increase that is from our muscles. Our muscles will hold, the blood sugar, and then when we start exercising, it will release them into the bloodstream. And so that's the second way. And then the third way is our liver can produce them. Mm-hmm. So if I want to get up and work out without eating anything, my liver will, release blood sugar. And so it's like I started to think about the body a little differently by saying there are different tanks of energy. Like if you drive a car, where does your energy come from? Well, it comes from the gasoline, right? But within our body, there's multiple ways where we can increase our blood sugar levels.
It's kind of like the hybrid vehicles that have part electric, and they can kind of switch between gas, electric.
Great point. That's a super great point. Yeah, that's exactly right. And so our bodies do that, right? So having that understanding made me realize, okay, when it comes to diabetes, when we're making recommendations, oftentimes we're kind of saying, go for a walk, half hour, 4 to 5 times a week, and you'll be fine. And for someone who's not doing that, that is really good advice. But for someone who's already doing that, there's more that can be done. So when we think about that, and we think about overall muscle mass, right? If you have a diabetic that has more muscle, and if muscle is one of those ways of both releasing blood sugar and also taking it back in, so when you eat something and your blood sugar levels increase, now that's going through your bloodstream, and then your body releases insulin. Where does that blood sugar, how do we get it back down? Well, insulin, will allow that to go into the muscles, right? So if you have diabetic A who has a certain level, a low body mass, a low muscle mass, and you have diabetic B who has high muscle mass, the one with more muscle mass is going to be able to absorb those blood sugars in a much more efficient way. So when we start to think about what exercise is going to be the best for diabetics, the resistance training plays a big role.
I was going to suggest, probably more weight training, resistance training.
Yes.
Because then, the idea is that you're increasing their muscle mass, which
Yes.
their muscle mass can absorb or really, am I correct in saying that, basically absorbing the sugars
Yes.
more into their tissues, so
Yes.
that brings things back down
Yes.
more naturally and an
That's
easier
exactly right. So if you don't have much muscle mass, your body is going to inefficiently bring those down. And a lot of times it won't bring them down. They'll stay up. So if you have more muscle mass, you have more ability to take in those sugars.
I think there's also certainly a challenge, is that a lot of our patients who are maybe type 2 diabetic usually have a little bit of excess weight, right? Especially even the more recent publications around like having fattier livers, or the amount of fat around the liver and the pancreas.
Yes.
That abdomen weight.
Yes, that's absolutely right. That's absolutely right. So I think sometimes we have to meet patients where they are. And if you have a patient that is doing no exercise, then certainly walking is going to be a big step up. But if they're already doing that, the idea of adding some muscle mass and making that recommendation by doing resistance training is a really good thing. And then there's the issue of intensity. And so if you have someone who's going to walk a half hour a day, that's good. But if someone is going to maybe do a spin class for a half hour, that intensity goes way up. And then that's going to give you additional benefits. So I think as it relates to diabetic retinopathy and diabetes in general, kind of saying that it's not just exercise. That's important, but it's not just that. It's the type of exercise, and it's the intensity of exercise.
Would you say, is that kind of what's also seen in terms of maybe benefits for high blood pressure, glaucoma?
Yeah, absolutely. And so with glaucoma, there's an additional factor that comes into play, and that is when we exercise, it brings down eye pressure. All right, so it actually brings it down. That's one factor. And the second factor is we know how important blood flow is in glaucoma in particular, all these things, but in glaucoma in particular. So you've got those two factors that help. Not only are you bringing down, in fact, an amazing study found, this was maybe a decade ago, that you can take any glaucoma patient and they're on any treatment. Maybe they take 1 drop or 2 drops, or maybe they had SLT, maybe they had MIGS, maybe they had a trap. Doesn't matter. And if you start consistent exercise, their eye pressure is going to come down 2 to 3 millimeters across the board. Like groundbreaking, right? But that's never talked about because it was kind of buried somewhere. So that's one of the messages I'm trying to get out as it relates to glaucoma, is it doesn't really matter where they're at, exercise is going to help them.
Does there certainly some concerns around glaucoma with either people lifting heavy weights with a Valsalva maneuvers, or head position, like with yoga, doing downward dog?
There absolutely is. And so when we have to be a little careful where we say exercise is good, but I think we do have to pull out that caveat that we do not want patients starting an exercise program and holding their breath while they're lifting huge amount of weights. That is going to be counterproductive. Down dog position in yoga, head down positions we stay away from. And then there's this other caveat. If they have pigmentary glaucoma, we want to be careful because a lot of times if they're starting, like I had a glaucoma patient who started getting really involved in jumping jacks and and jump rope. And so I said, you know what, maybe you ought to come in immediately after doing that. Let me just check your pressure. And he did, and his pressure was sky high. So those are the caveats. Exercise is good, but we have to remember that there are some caveats.
And for the pigment dispersion patient, is that just because we're worried about the iris rubbing?
Yeah, so when they're
pigment?
bouncing all around, as you can imagine, that iris lens, that's kind of bumping up against each other, and that's releasing pigment. And this patient actually had a pigment storm when they came in after that. So that's the only, the one glaucoma pathology, pigment dispersion, where I'm a little more cautious on, maybe it's best to do bicycling or something like that, where you're not, kind of bouncing up and down.
I think this is all very good. The other kind of interesting thought I had, in somewhat relation to exercise, because when you do exercise, it helps reduce and helps with managing stress.
Yes.
And I remember there was a few publications now, but as early as 2018, 2019, there were some research investigations into stress and its effect on things like eye pressure.
Yes.
And so I wonder if there's almost like a dual factor.
Yeah, there absolutely is. In fact, one thing, when we experience excess stress, we're releasing cortisol. And that what does that do to our blood sugar? It spikes it. So it's thought that people who are under significant stress in their lives, they have these periods of blood sugar roller coaster, and that's not good in diabetics, but that's not good in anyone. And so ways to manage stress. One thing that you said made me think of this. When it comes to depression, there was a study out recently that looked at patients who were being treated or diagnosed with depression. How should they be? They treated one group with the standard depression medications, and they treated the other group with exercise. And as it turns out, the exercise was superior in terms of effect than medications. And so I think we're on the cusp of all this exercise research that is saying, hey, exercise is so important in so many of these diseases, but particularly our interest is eye diseases.
I would like to see further thoughts, and maybe just your thoughts, but I'd like to see research in the realm of how exercise would maybe affect dry eye.
Yeah, right. And that is the one area where I haven't seen nearly as much information. I was able to really dig deeply on glaucoma, diabetic retinopathy, and macular degeneration, but dry eye, I think that space is ripe to really, really engage in some research.
Kind of what sparked my thought was because you mentioned depression.
Yes.
And for a lot of our patients with chronic diseases, whether it's diabetes or cancer, dry eyes being a chronic disease, there are patients who suffer from anxiety and depression related to that. And there's a bidirectionality too.
Exactly, and then you throw in many of these medications to treat those diseases, and that even worsens the dry eye even more. So I love your thought process as it relates to dry eye, and so I'm going to go back and double my efforts about looking at those. But if not, maybe consider some research studies.
Right. And either way, like high blood pressure, that's the silent killer and systemic disease. But and I often refer to that as kind of what glaucoma is in eye care world. It's a silent killer. We don't know it's happening until it's too late.
That's right.
But certainly that's one of my motivations is high blood pressure runs in my family.
Yes.
And I always knew exercise is supposed to help with my blood pressure. I should really make this a consistent thing.
High blood pressure runs in my family. And during my 20s and early 30s, we're in optometry school, a lot of stress, didn't necessarily have as many, as many outlets as I would have liked, even though I did my best to, work out during those times. It really wasn't until I started getting more involved in bicycling, more, endurance type stuff, that my blood pressure hasn't really become an issue since I started cycling in my early 30s. And here I am in my mid 50s, and I've got my heart rate, my resting heart rate is like in the low 50s, which is the best it's ever been in my whole life. Right. And so it's really fun to see what effect exercise, had on me from, keeping me off of high blood pressure medications.
I think I'm curious with your patients that you manage.
Yeah.
Do you just give these general recommendations? Do you send them or refer them to anybody?
Yeah.
I'm thinking like, what is the next step?
Yeah, no, you're so right about that, and it's such a good question, and it's one that I don't have a great answer for. But I will say this: is I do try to meet them where they are, and I'll have the exercise discussion and say, okay, tell me, like, in an average week, what kind of exercise are you doing? And invariably, patients will respond, well, I got this pain in my knee, and so I really can't even walk. Okay, well, can you go to the Y, because they have this water program, and it takes all the, or have you thought about a recumbent bicycle, even, a stationary one, because that's going to, that's not going to bother your joints as much. And so if they're doing absolutely no exercise, I try to bring up some helpful tips to get them in the game. And a lot of times, they'll equate exercise with going to the gym once, every day, and that's a bar that sometimes is too high for people. But so I'll start off with are you able to walk? Can you go to the Y to do aqua classes? Those types of things. If they're already doing those things, then I'll talk about intensity and increasing those. If they're doing those things, then I start to incorporate the idea of resistance training, and with things like Planet Fitness, which I have no conflict of interest there. It's $10 a month, and that maybe that's a good way to get into the system. So that's something that I recommend sometimes. But I do feel like, on one hand, I would say that when I tie exercise into the potential for blindness, I do think that we do a better job of enacting change, lifestyle change, than I've spoken to so many primary care providers who are just like, yeah, I talk to them about exercise. They never do anything, so I'm just going to prescribe them meds. When you tie vision into that, I think we do a better job, but it's still a system that could be improved.
Well, I think we kind of mentioned this a little bit before the show, but people just don't think they think of eyes, they think glasses.
Yes.
They don't realize that exercise isn't just good for your heart or your blood pressure, for losing weight.
Yes.
Like, it significantly affects your eyesight.
Yes.
And your eyes are an extension of your brain.
Yes.
And just, I think people start to like, whoa, it really is all connected.
It makes it a lot more real for them.
Yeah. I think the one other thing I've thought of, because I hit the gym a few days a week, and it can be a chore.
Yes.
For some people, and there's times I think everybody, it can be like, I just don't want to go.
Yes.
I went the other day.
Yes.
And so it becomes laborious.
Yes.
And so one thing that I've encouraged some of my patients to do, and while it maybe isn't as easy to get resistance training in that way,
Sure.
I always ask them, well, have you tried pickleball? Have you heard of pickleball? Have you heard of this other sport activity? Do you enjoy tennis?
Yes.
Something social.
Yes.
Where it's not a homework assignment, it's not laborious. It's like, this is a game.
Yes.
This is a chance for you to have fun.
Yes.
And be social.
Yes.
So I try to think of that even for myself. I'm like, hey, can I pick up a new sport? Can I join whether it be even like a bowling league, or can I pick up like a volleyball, for a summer?
Yes.
Because then, it's no longer exercise.
Yeah.
It is, but
Yes.
it's not. You're playing a game.
Yeah. There's so many things that you touched upon that are so important. If it's laborious, it's not sustainable. And so you're just kind of fighting, gritting your teeth, and you can't do that forever. So I love the idea. I just spent a couple of days with my business partner and our wives, and my business partner's wife said, pickleball has changed her life, right? and she was so passionate about telling us about pickleball, and she's like, I was never a huge exerciser, but now pickleball, I'm out there all the time, and now I have all these new friends that, and so you hit the nail on the head when you recommended pickleball because of the social aspect. And I used to play basketball until I ruptured my Achilles, but I had the same experience, like seeing these guys out and about in town, and we looked at each other and said hi, and having that bond, that social bond, was so great. And when I decided, based on my wife's urgings not to go back to playing basketball because of how long it took me to recover. For me, that was kind of a sad moment, right? But I've just replaced it by doing, more mountain biking. And so that's been, that's been great. So the point being is that there's some people who love something, and if it's taken away from them, they just give up. And I wanted to do, there are probably parts of me that wanted to do that, but there's always something else that they can, that can get them going, and maybe pickleball is that.
Is maybe that one.
Yeah.
Well, Mike, thanks so much for being here and being
goodness.
a guest. The final question I have for you is, and I love to kind of ask people this because it gives me a good perspective.
Sure.
But if you were somehow to wake up tomorrow and you were elected as the kind of Surgeon General for optometry,
Yes.
If there was one thing that you wish would either you could change about the profession or you could change about healthcare,
Yes.
To help patients.
Yes.
What would be your mission? What's the one thing that you wish you could see it change?
So I guess the way I would answer that is within, and I'll start off with glaucoma, but it's more relevant than just glaucoma, is that, how do we manage glaucoma? We wait for damage to occur, and then we treat it often way too slowly, right? And so these patients, we're managing based on decline, right? How much decline are we willing to accept? And so for me, several years ago, the light bulb went off to say, hey, there's interventional glaucoma jumping in at a much earlier time point. It really can preserve patients' vision to a much greater extent. And so I think as a profession, we do a great job with all these eye diseases, but jumping in sooner, intervening at an earlier time point, whether it's glaucoma, whether it's diabetic retinopathy, by having the exercise discussion earlier on, whether it's macular degeneration and getting more involved in nutraceuticals, whether it's dry eye. And we now have some really good procedure-based, treatments. And so this concept of, well, we'll wait till, they're really complaining, then maybe we'll, recommend over the counter, and then maybe we'll recommend, all these other, immunomodulators. But years go by and patients aren't getting the relief that they deserve. So I would say, in general, jumping in, being interventional about our treatments, jumping in at a much earlier time point, and having the realization that exercise is so important as it relates to eye disease.
Well, what kind of exercise are you going to get here while you're at Academy?
Oh, so I've been walking more than I typically do, back and forth to different meetings. But also, there's a Peloton in the gym. I did some resistance training this morning. I jumped on the Peloton for a little bit. So those are ways, and not to say that any of that is equaling my caloric load this week, right? but at least it gives me an opportunity to rev up the body and get some exercise in.
That's great. Well, thank you again so much, Mike, for being here. I really appreciate it.
The pleasure was mine, really.
And hopefully maybe sometime we'll have you back on and we'll talk more about exercise or other cool things with kind of preventative health and earlier intervention.
I would enjoy that.
So that was our episode for today. Thank you so much for tuning in. If you did find value in this episode and like to hear more, make sure to subscribe to us either on YouTube or follow us on wherever you get your podcasts from. Otherwise, I appreciate you guys listening in and hope you have a fantastic